Now that we have spent some time discussing proper nutrition, I want to talk about the female athlete triad, and this is a consequence of malnutrition. The female athlete triad is a link between energy imbalance, menstrual dysfunction, and low bone mineral density. In the athletic population, this is going to be common in sports requiring a leaner body image, such as gymnastics and cheer. We're going to start our discussion by talking about energy imbalance. Energy availability is the amount of dietary energy required to maintain normal body function after considering energy expenditure. Low energy availability is what we're going to see in association with the triad. Now, disordered eating refers to insufficient caloric intake in the presence or absence of an eating disorder. While you don't need to specifically cover eating disorders with the athletes, I want to discuss them with you so that way you could have a better understanding of what they are. So looking here, we have anorexia nervosa, which is intense fear of gaining weight, and an expected body fat less than 85% for age and height. Bulimia nervosa is episodes of binge eating which can be followed by compensatory behaviors. And anorexia athletica is disordered eating specifically in the female athlete. This is commonly seen with reduced energy intake and excessive exercise. Later in the module, I'll provide a simple overview which will hopefully educate you about the signs and symptoms. We're now going to discuss menstrual dysfunction. And this can be a variety of disorders including amenorrhea, anovulation, or oligomenorrhea. Now, I mentioned amenorrhea in the previous module, so I'm going to go ahead and discuss it further here. This is marked by an absence of period for any time greater than or equal to 3 months. Primary amenorrhea is marked by delayed start of menstruation, while secondary amenorrhea is a loss of period after the start of menstruation. Functional hypothalamic amenorrhea is exercise-induced and is very common to see in athletes. Now, the last part of the triad is a low bone mineral density. By age 18, most adolescents will have about 90% of their total body bone mineral content. Now, research has shown that physical activity should actually increase bone mass density, which is the opposite of what we see here. So low bone mineral density is seen in amenorrheic individuals due to low estrogen levels. As I mentioned previously, vitamin D and calcium are important for bone health. Therefore, a deficiency can contribute to low bone mineral density as well. Adequate intake of calcium and vitamin D should be emphasized in your presentation with athletes for this specific reason. Inadequate intake of essential amino acids and fatty acids can also contribute to low bone mineral density. The information presented on this slide is the most important takeaway of this conversation and is some of the most valuable information that you can present to your athletes in relation to this topic. So really, if you wanted to, you could give a very, very brief overview of the triad components, but really highlight the effects that we see here. These effects can last a lifetime, so what they do now can greatly influence their future. Some of the consequences we see from the female athlete triad are increased injury recovery time, impaired immune function, decreased muscle mass or inability to maintain muscle mass, increased risk for stress fracture, increased risk for mental illness, increased risk for cardiovascular disease, and increased chance of fertility issues in the future. Now we're going to talk about screening and treatment. This typically takes place during the pre-participation physical, which you may or may not be involved in, depending on how your school is set up. But some important components included are health history, physical activity, dietary habits, and menstrual status. Now, I did put some specific signs here. I just want to briefly talk about the eating disorders. So with bulimia nervosa, we may see some dental issues. And with anorexia nervosa, we may see dry skin, yellow or orange tinted skin, and blue or purple tinted coloring of the hands and feet. Now, these would be okay to discuss with the athletes, as it's important that they know these signs so that they can help individuals seek treatment if needed. Now, treatment is a multidisciplinary approach. This means that we need to have multiple medical professionals involved. We can't just send them to a physician, wipe our hands clean. We need to be involved, maybe a therapist, maybe a dietitian, and we definitely need to see some support from family members and peers. Now, at the end of this module, I provided some links to screening tools to help you think about what you should look for when assessing someone for symptoms of the triad. It may be included in your own physicals if you are responsible for holding those.